Hey guys, Nathan here from the Paramedic Preload, and the topic today that I really want to drop in on is going to be an IV drip, but given over time. And so this drip over time, what do we utilize this for? This is going to be somebody who we are trying to figure out how much fluid we need to give within a certain period of time, and how do we get the exact amount that they're asking for. Now, this could come from us doing transfers, interfacility transfers, going from hospital to hospital, and they may say, hey, I'm going to need 500 cc's between now and the time that you reach that other facility, which could be, an hour and 20 minutes, 2 hours, it could be 3 hours. They're going to give you a time, and you essentially need to be able to figure out how to do this. The other time that we might do this is if we are dealing with burn formulas, and we deal with the Parkland burn formula or the consensus formula, whichever one that we talk about or use. But within that first period, we are giving a certain amount of fluid over time based on their burn percentage. And so this does come in handy at times. And so we're just going to take a couple quick looks at this and just see how we can utilize this formula to make ourselves better out there in the field. So this formula is very, very straightforward and simple. There's only a few things that we need to know. So for drops over time, the first thing that we need to know is what we are solving for. And we are going to be solving for drops per minute. And that's what we're solving for. And then what we need to know is how much volume is to be administered. And that's going to be times our IV tube size. And we are going to divide that by time in minutes. Now, very important that we remember this is time in minutes, because we say, okay, well, I've got to go someplace and it's going to take us 2 hours to get there, and I have to give 250 cc's before I get there. Well, we can't just put in a 2 right there. We actually have to do that in minutes. So it would be 120. Obviously, a 1 hour would be 60 minutes, 75 minutes, 85 minutes, however we want to do that for an hour, and, 15 minutes, an hour and a half, 3.5 hours. We have to do the math. So we need to be able to divide that up. But once we know how much time is in minutes, not hours, but in actual minutes, then we can plug this in. And let's take a look at a quick example of that. So let's take, for example, that a doctor orders 120 cc's over the next 45 minutes while you're on a transfer. So let's go ahead and plug that in. So if you remember, this is volume to be administered, which would be 120 cc's. And then our IV tubing size, which we can talk about here in just a second, and our time in minutes, which we talked about, which is going to be 45 minutes on that transfer. So that is, and I'm going to put minutes just as a reminder, we don't put hours there. So let's talk about our IV tubing sizes. If you remember, in previous episodes, one thing that we talked about is we talked about 60 drops. We talked about 15 drops. We talked about 10 drops. Those are going to be your main sets that we use out there. And not to say there's not other sets out there. There are 20 drops and there's some of those, but we just need to know what they give it to us. So let's say they give us the 60 drop set and they're like, hey, out of this bag, 120 cc's needs to be given over the next 45 minutes. And we have a 60 drop set. So what we're going to do is we are going to do 120 times 60. And so that is going to give us 7,200. And we're going to divide that by time in minutes. And so we're going to do 7,200 divided by 45. And we know that with a 60 drop, this would equal that we need 160 per minute to give 120 cc's of fluid in that 45-minute transport. So as you can see, this is pretty simple math overall in the way that we work through this. And it's actually really, really fast to try to figure this out. It's just taking that time to get that formula, even if you have to pull this out of a cheat sheet or a little notebook. Let's go ahead and erase some of this and let's come back up and let's change this really quick. Let's say that they hand you 1,000 bag and they say, hey, you know what? We already had this set up, but we need you to give 120 cc's with this 10 drop set that you have. You look over and you realize it's a big 10 drop set. and in that 45 minutes. So how does that change our math a little bit? Well, that is going to change it up a little bit because we don't need as many drops per minute because it only takes 10 drops to make a cc here. So when we actually put this all together and we do the 120 cc's times our 10 drops, that is actually going to be 1,200 over that 45 minutes. And so we need to then do that math. So 1,200 divided by 45. And what that tells us is if we give 26 drops a minute, we are able to give the desired amount of 120 cc's over 45 minutes. And so you can do this with a 15 drop. You can plug that in. You can do it with a 20 drop. You can make up your own drop set if you want. Regardless, just as long as you know what drop set you're working with, how much I need to give, and in what period of time I need to give, this allows you to be able to put this all together. So let's look at another example. So when you get on this next transfer, the physician is ordering for you to give 800 cc's over the next 3 hours and 20 minutes in your transfer. And you know it's going to take them that long to get there. And he says, hey, here's what I need. I need 800 cc's by the time that you reach your destination. So with that, what can we do? We can plug this in to figure out how many drops per minute. So volume to be administered, we have 800 cc's times our IV tubing size. And we'll say that he put that on a 10 drop for you. So we've got that on a 10 drop. That's a pretty, it's a lot of fluid. It's a fairly large amount. So more than likely going to be on a 10 drop. And we said we want it over 3 hours and 20 minutes, which is right here. Now, the one problem is we can't give this over, we can't just put this into our formula. Sorry. We need time in minutes. We can't just put 3.20. It doesn't make any sense. So how do we get that number? Well, just simple math, right? You're going to do 3 times 60. So we do that whole 3 times 60, and that should equal 180. So that's 180 minutes because there's 60 minutes in an hour and we have 3 hours. So 3 times 60 is 180. Now we know we need an hour, or I apologize, 3 hours and 20 minutes. So on top of that 180, we add the 20 minutes, which will be 200 minutes. And there's our formula that we can work with. So on this transfer here, let me get rid of some of this so we can work this out. So we do the 800 times 10, which is 8,000. We divide that by our 200. And that is going to equal 40. So that is going to be 40 drops per minute. And if we give 40 drops a minute, that means by the time we reach our destination in 3 hours and 20 minutes, that we have given a total of 800 cc's of that fluid in that 3 hours and 20 minute transfer. Now, the other way to look at this is, as we've talked about it before, this is a 10 drop. So for every 10 drops, we get 1 cc. So how many cc's are we actually giving a minute? Well, that is going to equal 4 cc's per minute. And so now we know that, hey, we're given 40 drops a minute, which is roughly about 4 cc's per minute. And if we do that over the 200 minutes, what do we get? We get 800 cc's by the time we reach our destination. So I hope this helps you. I hope this kind of takes some of that mystery out of this. It's super simple formula. Volume to be administered times our IV tubing size, and we divide it by time, specifically in minutes. Once we put that in, we are gold. We are good to go. It tells us how many drops per minute that we need, and we go ahead and take that on the road so that we can make sure that our patient gets all the fluid that they need prior to getting to that destination. Hope you guys find some help in this. If you guys got any questions, please throw them in the comments, and thank you for watching.